Today we are going to discuss about the circulation of blood to the head and the neck. So as we know, the blood supply to the head and the neck, it is done by the right and the left common carotid arteries and the vertebral arteries. Now, where is the origin of the carotid artery and the vertebral arteries, we will see. As we know, this is the aorta. This is the aortic wall. Right, and this is called as ascending aorta. So through this ascending aorta, we are going to have 1, 2 and 3 branches. The first branch, it is called as brachiocephalic trunk. The second branch, it is called as left common carotid artery. Left common carotid artery. And the third branch, it is called as the left subclavian artery. These two are called as left common carotid artery and left subclavian artery because if we consider this as a heart, there are 4 chambers. So from the left atrium, this aorta is going to arise, and these 2 parts are going around the left region, right? And this is coming at the one branch, it is coming at the right region. So because of that reason, these 2 branches of this aorta, they are called as left common carotid artery and left subclavian artery. Now we know this brachiocephalic trunk, it is going to divide into 2. This one branch is called as your left subclavian artery, here it is called as a right subclavian artery. And one more branch, it has gone, see this one branch is gone into 2. This one more branch, it is called, here it is left common carotid artery, so here it will be the right common carotid artery. I hope this is clear. The brachiocephalic artery, it is divided into 2, that is the right subclavian artery and the right common carotid artery. And here we can see the left subclavian artery, here one more branch is gone. This is called as the left vertebral artery. In the same way, we can see here in the right subclavian artery, here one branch is gone. This is called as right vertebral artery. Now this right vertebral artery and the left vertebral artery, this together they are going to go upside and they are going to join at this region. They are going to join at this region, and this, it is going to form a single artery, and this artery where it is joined, where 2 arteries are joined together, is called as basilar artery. Right, This is called as basilar artery. Here we can see the right vertebral artery this side, and here it is the right common carotid artery. This right common carotid artery, here one more branches you can see. This is called as the right external carotid artery. Right external carotid artery. And this particular branch, it is going to supply to the facial, like on the face, that is called as right facial artery. And at the left side it will be the left facial artery, and this will be called as the left external carotid artery. I hope this is clear. The right common carotid artery, it is going to come and form one more branch called as right external carotid artery, and one more, that is the right facial artery. In the same way, left side, the left common carotid artery, it is going to branch and form the left external carotid artery, and here the left facial artery. This basilar artery is going to go front and going to form the two branches called as the right posterior carotid artery, right posterior carotid artery, and here left posterior carotid artery. Posterior means it is going to go back side. Back side it is going to come like this, and it is going to form the posterior carotid artery. This two, what you can see, the branches, it is called as the left posterior communicating artery. These are going to communicate between here and here. This is the right posterior communicating artery. Now here we had seen the right external carotid artery, right here. Now here we will see the right internal carotid artery. Right internal carotid artery. Yes, and in the same way, the left side also we can see. This is called as the left internal carotid artery, right? Now this part, it is called as the right anterior cerebral artery. And this is called as the left anterior cerebral artery. So basically these two are the anterior cerebral artery. Right and left we can differentiate. Next here it is the posterior carotid artery. Here we can differentiate between the right and the left. And here we can see what the arterial circle of villi. This is called as the arterial circle of villi.